The movie that I chose is Kissing Jessica Stein, a 2002 film. So the movie follows the story of a woman named Jessica Stein who has a severe anxiety disorder and is having trouble understanding her own sexuality, mostly due to her struggle to find a man. She decides to explore her feelings toward women by confiding in a woman by the name of Helen. In doing so, she becomes very tense and anxious at the thought of being intimate with a woman and is fearful of others' opinions of her. Okay, this is Jessica, this is Helen. Cool, yeah. A little bit about Jessica. Jessica Stein works at a newspaper company. She speaks very fast, usually due to her overthinking. She gets extremely nervous when anything relating to lesbianism is brought up and was only with men before she met Helen. At times, she can be very indecisive and seems to have a lack of confidence. Her life, according to her, was perfect. She had a good job, but no hobbies, and her boss was her ex, which, yikes. Very sweet, but has a hard time saying no. Yeah. Okay, a little bit about the movie. The movie was set in the early 2000s, in which gay rights were only becoming acceptable just then, and even so was still slightly taboo from the 90s. Lots of people were very judgmental, and it was hard to be an outwardly gay couple. Also noting that Jessica is Jew in the movie, which at the time does not support homosexual acts. So the actual being together in a homosexual relationship was okay, just not the sexual acts and intimacy together. As far as fashion, low-cut jeans, mean girl, short shirts. What disorder does Jessica have? I diagnosed her with social anxiety disorder, which is characterized by extreme and present fear of anxiety and avoidance of social situation in which a person could potentially be evaluated negatively by others. She had extreme fear of others' opinions of her. If Jessica were to go to a therapist in her time, I believe that they would diagnose her with the exact same thing, because not set far back enough to where they would be like, there's something wrong with your brain because you like girls, blah, blah, blah. As far as the diagnosis in the culture, basically what I said in this paragraph is that one of the differences in culture, and I use an example from Japanese cultures, they have something similar called TKS that's very similar to SAD, which is the acronym for social anxiety disorder. Those with TKS fear embarrassing others, but SAD fears embarrassing like yourself. So that's one of the differences, and a lot of different cultures vary in SAD, but just, obviously due to their culture. Okay, stigmas: unpredictable behavior, dangerous, unlikely to recover, hard to talk to, crazy, victim of stereotypes. Basically, people with mental disorders are crazy. They're unpredictable, and it's hard to have conversations with them, even though it probably isn't, and you don't really know what extremity they have, but you're gonna make that assumption, at least in Western culture. Okay, evidence. I'm just going to show you these two videos. Basically, symptoms. Right now, she's showing self-medication as a means to avert anxiety symptoms. Excessive alcohol is how she chooses to do this. Let me just drink.
Okay, I have like 20 minutes.
Well, but wait. This is Larry. That must have been.
I was thinking about it
A month ago.
Okay, but it was good. I mean, right? It was good, wasn't it good?
You drank a bottle of wine.
No, I didn't. That's not true. I had maybe 2 and a half.
Just what we.
Okay, next is she avoids eye contact, which is a safety behavior.
Why want to go to your dinner so frazzled?
Oh, my dinner. Right.
Yeah, I think a little red wine would really help to,
Okay, so Jessica doesn't have problems with social situations. Basically what I said is she doesn't have problems with generalized issues. She can speak, she can talk, have a conversation, she can go out to eat. This being because like she never had a problem with this. The problem is with women, like her relationships with women. That's like what makes her nervous. Okay, treatment plan, cognitive behavior therapy. I think this would be the best situation for her. I'm not going to go too in depth with it because I only have 5 minutes. It's proven to be helpful. People with these anxiety disorders tend to think in a negative way, fueling their negative emotions of anxiety and fear. The goal of cognitive behavioral therapy is to identify and correct these negative thoughts and beliefs. The idea is that if you change the way that you think, you can change the way that you feel. With that being said, Jessica could learn how to cope, how to confront her fears, and what exactly caused her anxiety. Okay, so ethical concerns are usually it's about basically distress. Like you purposefully put your patients in distress. that is mostly what causes these ethical issues, because people don't see it as morally correct to do so, but obviously it's for a positive reason. They don't care. The only reason I could see Jessica not going to a therapist is because she gets so embedded in her work. Other than that, she literally talks about in the movie that she has a therapist. So I think she would go. Okay. The movie portrayal of Jessica's character was very well done, in my opinion. I like her subtle hints of like talking over people or avoidance, like those little hints of like, oh, she has that anxiety disorder. And the movie helped me understand like extremities of the disease. So, and help me understand how that plays into like people with anxiety disorders, how it like works in their everyday life. Okay, thank you. Okay, there we go.